Yeah, so monkeypox is a virus and it belongs to a particular family of viruses. There's a whole range of so-called pox viruses. And one of the pox viruses I think people may not be familiar with is smallpox, for example. So this virus belongs to a similar family, if you like, of viruses. It's what we call a zoonotic virus. In other words, it was mainly found primarily in animals and particularly in rodents. But it has unfortunately the tag of being called monkeypox because I think it was first identified in monkeys. But the first, I suppose, reported human case of so-called monkeypox was in the 1970s. So it's a zoonotic, in other words, it's a zoonotic virus. It's transmitted from the animal to human. And again, there are various ways in which this can happen. It could be inhalation of droplets, for example, exposure to feces or to secretions. And this is the way in which the virus enters the bodies.
Monkeypox is a viral disease. Mainly, it presents with fever, enlargement of lymph nodes, and rashes on the body. And the way it spreads, mainly through direct contact with either infected individual, infected animal, or infected clothing.
What we're currently facing is probably the largest outbreak outside of so-called endemic circulation. We're over what is reported to be about 3,000 cases in about 20 to 30 countries, in fact. It hasn't been declared what they call it, an emergency as yet by the WHO, but I believe they are meeting today to discuss about this particular virus and whether or not it should be declared.
It depends on the transmission mechanism, actually. For monkeypox, as you know, it's a disease that is similar to smallpox, but it's the severity is lesser. Infectivity is also lesser with monkeypox compared to smallpox. So this is a disease also that is has been found to be endemic in some parts of some parts of Africa, but recently there has been documentation of cases in Europe and in the United States where there is no linkage to history of travel to these endemic countries. So this is the dynamics that it's a bit worrying because in terms of epidemiology, you want to understand the source of infection, because that way it's easier to address it from the root, and then you can actually take care of it. But without knowing the source of infection, even though we know that current transmission in some western parts of the world is among special group of people, but we need to understand how these infections got into that population in the first place. This can help with the issue of control of this outbreak.
The risk for the general population in the main is low. One needs to be cautious, of course, as always, but in the main, I don't think we're going to see it to the same levels as we are certainly seeing for COVID-19. We certainly are seeing an extraordinary number of cases but again, when you think about it, what was being reported from Africa, where there's been the endemic circulation, as we called it previously, we don't have the numbers. There's been not real testing, no serological surveillance conducted to really know the nature and extent of this endemicity, if you like. And that's why I come back to the example of the outbreak in Nigeria, because that's been ongoing since, I think, about 2017, but probably earlier, possibly. But we don't really know the full nature and the extent of such outbreaks.
So it's really difficult to tell as the outbreak continues to spread and evolve. There are still a number of things that are still not understood with regards to this outbreak. So it's difficult to really predict how the virus is going to behave. But the most important thing is that once we have an infection ongoing and we can see that it is spreading around the world, Countries that are not affected yet, they need to be prepared to put capacity in place to detect early and mount an effective response. And countries that are infected already or they have recorded cases, they need to make sure that they ramp up the response for this outbreak, because every outbreak, there is every potential for early containment if you start early.
For the general population, thus far, this is at a low to moderate risk. So in terms of their exposures, as I said, I would think that the main concerns are in specific networks, specific families possibly, where there's close contact. So again, when you're thinking about certain events, again, where there's close contact, such as festivals, parties, and so forth, where there's going to be close contact, as well as the possibility of sexual contact, equal exposure. Those are the areas where you really want to work with communities to really educate communities to, again, try and prevent, as you one would do for sexually transmitted infections, again, counsel about safe sexual practices. I think that's really going to be critical. Again, this virus, as I said, it's self-limiting. Scarring is the main outcome in the main, so it does resolve. But again, it will take a while. Only once the skin is really healed does transmission really stop. As you know, we used to vaccinate with smallpox, but individuals younger than the age of 40 to 50 won't really have that protection anymore, or not at all, in fact. So there's this immunity gap, if you like. So that does make people more susceptible to this. But as I said, it is a self-limiting virus at best.
So for every emergency, there is an action to take. Panic will not help the situation. We need to make sure that we do not adopt what the independent panel for COVID response said is a wait and watch scenario. So that is not good. Once there is something happening around, whether you perceive that your country is at risk or not, it is important to make sure that countries check their capacity to detect. First of all, are they doing the surveillance? Can they confirm? Can they provide clinical care? Is the population informed? So all these things need to be put in place so that they are ready in case monkeypox are detected. They don't start running helter-skelter, but at least they have the capacity. So it's a good time, especially for those that already, you have your PCR machine, you have your laboratory scientists. Then it's good once you get the reagent to make sure that this lab can actually confirm monkeypox. It helps, it will reduce the timeline compared to if you have to ship your sample to another country to test. So it will reduce that timeline of confirmation and to ramp up everything. So there is benefits actually in preparing, whether or not a country feels that they are at risk.